common thing that we see in this office is balance issues. We see on average, I'm going to say anywhere between 6 to 10 clients a quarter that are dealing with some form of balance issues. Now, when we talk about balance, it can be a lot of different things. I mean, we've got to understand, and this is what comes through of actually having a careful history, detailed history, understanding of the mechanisms, meaning what's triggering it and what's causing it, so we can have a better understanding of how we're going to work on understanding and coming up with a care plan or a treatment protocol. So, a lot of times we can either have people that have dizziness, vertigo type things, and we've talked about that, or they could actually just have no spinning and just having instability. So again, a lot of times we want to have a better understanding of what is going on, and that comes through taking those careful histories. But so much of what we see with balance issues is vestibular in nature, meaning it's coming from the inner ear and our balance centers that are going on. As we look at these issues, so much of it is neurologically based, meaning it's coming from the nervous system and it's coming from the inner ear that's affecting that. As we look at this, we can see how people their core may be a little bit weaker. And one of the biggest risk factors is, for balance is we're going to say with the older populace, we're going to say anybody in their 60 plus, as we look at how the risk factor for falling and hurting themselves, breaking a hip, injuring, breaking an arm or a leg or an ankle or something like that. So there's high risk factors with balance, and it's so important that we really work on creating a good, stable platform for these folks as quickly and as efficiently as possible. So again, as we talk about this being neurological in nature, what that means is the neurology from the brain all the way down to the feet is mismatched, and sometimes it's also centered on the eyes. Now, within our brain, or right where our brain meets our spinal cord, right where C1 and C2 lie, is we have a reflex called the righting reflex. Now, what that righting reflex is it's constantly focused on the horizon. So no different than, little kids or somebody on a boat that gets seasick, or a person in a car that gets car sick. They've lost focus with the horizon. The two people that never get car sick or seasick on a boat are the captain of the ship or the driver of the car. It's because they're always looking at the horizon. So they've got a good focal point. A lot of times what we see is with these vestibular issues is there's a neurological, I call it mismatch going on, where their brain can't understand where their body is in its spatial relationship, meaning where they are in their orientation. And their brain has this thing where it just can't understand what is happening. And again, primarily we see that these vestibular nerves, or some of these nerves within the inner ear, are actually compromising this. Now, there's a number of things out there, and we've seen folks that have come to us and they have tried measures like, hey, I've tried, I looked on YouTube and I tried the Epley maneuver, and we'll say, you know what, I'm glad that you tried that, but it's really not necessarily going to work, because it's one of those things you can't do on yourself. You need somebody to guide you through it to actually do it effectively. Hi, I'm Dr. Sweeney, and I've been practicing in Austin for 20 years this little known technique called the Nuka method. And the Nuka method is a very unique upper cervical based chiropractic technique where we look at the relationship between the head and the neck and C1, C2, and C3, so the top vertebra in that spine. We're having a positive influence on those cranial nerves, the vagus nerve, the nerves that are going specifically to our inner ear, as well as making sure that if there's any malrotation of any of those vertebrae, that could be compromising your position, also compromising how our body's able to turn our head left and right, but how our body neurologically is working and how we may work on correcting those neurological mismatches, as I call them. So we do this through very unique methodology. We do that by taking a very detailed history, having a very detailed examination where we're looking at posture. We talk about posture being the window to your spine. If your posture's off, meaning if our head's tilting, our shoulders are off, we're twisting our torso, we've got our hips are off, maybe one leg's longer or shorter than the other, then guess what? Your spine's going to be off as well. We want to work on helping to get your body into a better state of alignment. And we do that through our unique methodologies where we're not doing any traditional twisting, popping, or cracking that you normally think of when you think of the word chiropractor. We do that through our unique 3D x-rays that we take. We take pictures where we actually look at the spine from a three-dimensional model to actually assess what's going on with you and how your misalignment is actually maybe impacting or affecting your body. We do, again, that very gently. So if you've tried some of these procedures at home, maybe again, like I mentioned earlier, you've researched balance, you've trying to determine what's going on, you're having this instability, you've tried the Epley maneuver at home and it's not to no avail and it's not helping. Here are a couple other tips and tricks that I want you to try, okay? First and foremost, I want you to walk around the house barefoot. Now again, what that's going to do is help build your tactile, where you're actually connecting with the earth and with the ground and where your body's at. The next thing I want you to do is do some claw exercises with your toes and your foot. So you're actually going to try to grab things, maybe pick up little things with your toes, see how that works. We want to build that tactile sense. We want to actively make our brain work with our feet and work on building that communication. The other thing is a wobble board. This is a little inflatable seat, but it also works as a wobble board. There's also Bosu boards, there's wooden versions. And I'd first have you start with on the ground and rocking your foot front to back, side to side, and actually helping to engage that. Ultimately, slowly, with maybe stabilizing as you're standing and doing that work to building your balance and building your core. The other thing we need to do is build those core muscles. We need to build that up. So even doing assisted squats where you're actually stabilizing and holding on to things and building your leg and your knee muscles and your lower leg muscles. The other thing is we're going to do is some stripping muscles of the lower calf and the lower leg, working from the knee down towards the foot and actually engaging some of those muscles and how they may get tight. So again, if you've tried some of these tips, tried some of these things at home and still to no avail, we would be happy to have a conversation with you and kind of talk with you about what it is that we can do for you. So we do these free consultations, and we can set up a consultation where we would be able to have a conversation with you, finding out what's going on in your case and how we may be able to help. So again, we look forward to speaking with you, and until we do, farewell, be well, and be grateful.